At the moment in Shepparton we have a total of 126 active cases of people who have tested positive for COVID. That's an increase of 13 in the last 24-hour reporting period. All of those people are linked. There's no unknown sources and they are all in quarantine at the moment and were when their tests were undertaken. We now have over 100 exposure sites right across Shepparton, so we're encouraging people to keep their eyes on all of those exposure sites, of course not just in Shepparton but in terms of the whole Shepparton-Mooroopna area and locations to the north and south and east of Shepparton as well. So please keep an eye on the coronavirus.vic.gov.au website, because that's where you'll get all the information about exposure sites. And of course anyone who hasn't been tested but's been to an exposure site, you need to come forward and get tested straight away, because that's going to be the best way to allow us to understand what's happening in relation to the outbreak. So today is a big day in terms of the day 13 testing that's underway right across all of the testing locations at GV Health. So we've got a total of over around about 120 people working across all of the testing sites today between our drive-through locations, which have around about 12 lanes working really fast and as quickly as they can, plus we've got 2 walk-up clinics that are operating as well. Those people are working as hard as long as they can, and I'd just like to thank them for their efforts. I'd also like to thank the community members that have come out, of course, for their day 13 testing in terms of that needs to be undertaken, but also for their patience, because I do appreciate and acknowledge some of the waiting times have been a little long, but we've got plenty of capacity to be able to meet that demand over the course of the day, and a number of those sites will be staying open till 8 p.m. tonight to be able to meet that demand. As at 2 o'clock today, our testing numbers that are so far in regards to total tests from when we opened this morning at around about 8 or 8:30 a.m. to 2 o'clock so far, there's 3,481 people that have been tested, which is a pretty remarkable effort. So again, thanks to all of the people who have come forward and waited in the lines, but in particular thanks to all of the staff, not just GV Health staff, there's people from other health services in rural Victoria, council staff, and also people from private pathology providers, and of course the ADF. So it really is a team effort to be able to achieve something like that. So in terms of, as I said, we're anticipating around about 4,000 people that need a day 13 test. On the numbers we've seen so far, there'll probably be more people than that being tested, which is fine. And as I said before, we've got plenty of capacity to be able to meet that demand this afternoon. Just in terms of the process for people to come out of quarantine, so in the next 24 hours or so after people are getting their results of their pathology tests, it is a 2-step process. So once you receive, hopefully, a negative result for your test, then that's step 1 of the process. That'll be, of course, good news and welcome news, but it doesn't mean that you're free to go from quarantine period then. You still require an additional notification and formal communication from the Department of Health in order to be able to release you from quarantine. So 2-step process, pathology result first, and second is the important one, of course, which is in relation to the formal release from quarantine. So that process, I understand the Department of Health have allocated some additional resources to ensure that things are turned around as quickly as possible in terms of the test results entering into the centralised databases, and then that information being shared with people accordingly. The last thing I just would like to share with people, of course, is the importance of vaccination. So we know that really the only way we're going to get on top of this outbreak locally, but indeed the pandemic overall, is if we have more people getting vaccinated. So certainly the 70 to 80% mark is the goal. In relation to our vaccination centre here at the hub at Macintosh Centre, yesterday we delivered over 1,000 vaccinations, which is a great effort. There's plenty of appointments that are available. People not only in Shepparton but across the region and Victoria can make bookings in the state-based hubs by calling 1800 375 698 and making a booking, or coronavirus.vic.gov.au. But of course there's vaccinations available at general practices and community pharmacies as well. Specifically in relation to the Shepparton local government area, at the moment the rates are a little bit low in terms of where we would like them to be. So for the Shepparton local government area, 45% of people have had, or eligible people have had a single dose of COVID vaccine, and 26% have had a second dose. So again, that's low numbers. It's not where we would like them to be. So if you haven't been vaccinated yet, please make an appointment to get vaccinated as soon as you can. And as I said before, there's additional capacity right across our sites here, but we're also operating a number of other spoke sites with partner health services across the Goulburn Valley and across parts of northeast Victoria as well. So please book an appointment, and in that sense, the areas we're covering, we've been able to deliver across our local public health unit around over 75,000 vaccinations, and then at the Macintosh Centre here in Shepparton alone, we've delivered over 45,000 vaccinations as well. But again, plenty of capacity, and we really want to see those numbers for our Shepparton local government area start to increase in coming weeks. Happy to take any questions, thanks.
Can I just get a confirmation on that 75,000 vaccinations you were just speaking about then? What area is that? Sorry.
The local public health unit, we are working with those partner health services in Kilmore, Seymour, across to Mansfield, back through Benalla, Shepparton up to Cobram, and then down through Kyabram. So that's our area for our local public health unit. It's quite a decent part of the state, but it's a lot of work and energy that's gone on with some terrific people at those health services to achieve those results.
In terms of the testing we've seen today, obviously a very high volume and very quickly, is that great to see?
Yeah, it's terrific. And really thankful for the community to come out and get behind the testing today. So almost 3,500 is a terrific result. So I'm really confident for the rest of the day that we'll have plenty of capacity, and as I mentioned before, there's a number of testing sites that are open until 8 p.m, and all of those details are on our Facebook page for people should they need them.
And in terms of tomorrow, what are you thinking numbers-wise will you be looking at?
So yesterday our testing numbers were in the order of about 1,400 to 1,500 people. We know from our modelling that the big demand was for today in the order of 4,000. I think it's going to be, for the coming few days, it'll probably be more closely in the order of at least 1,000 people, and then start to taper through from there. But we'll make sure for the remainder of this outbreak that we'll have plenty of testing capacity. Obviously we were really geared up and focused on today because that was our biggest day, but there'll be plenty of access to testing capacity in the coming days and weeks ahead.
How important is it that people wait for that second text to actually come through and not take the negative result as their release from quarantine tomorrow?
Well, it's critically important that people wait for that formal communication from the Department of Health, because without that, from a legal point of view, you're not actually authorised to go out of or be released from your quarantine. So it is a legal requirement under the current public health directions. So people really do need to pay attention to that second text. So celebrate a little bit, of course, when you get the first test, and of course if it's negative, but you really have to wait till that second test before you can be released in terms of that coming from the Department of Health. I should say that anyone who does test positive as part of their 13-day testing program, that's a separate process, and they'll be contacted by the contact tracing team should that occur.
In terms of the cases today, are any of them as a result of day 13 testing? Is there a reason why the numbers are higher?
No, I noticed there was a little bit of commentary in the press conference in Melbourne about that today. It's my understanding that all of the cases today are linked household contacts. It's not related to day 13 testing as far as I'm aware, so it's more that, and that's why we're we're confident and comfortable that they're able to be linked because they're people in households that were particularly asked to come forward for testing by the contact tracing team.
Has there been any positives that have come out of day 13 tests? I know some of the early exposure sites would have had their day 13 tests by now.
No, not that I'm aware of, that there hasn't been any positives from day 13 testing, but we'll have some good information in the coming probably 24 to 48 hours in relation to, with such a big volume of people coming through now. But certainly some of the people that are testing positive at the minute are household contacts, and that's where we know the virus is spreading really quickly through households.
How many people have you got in hospital here at the moment?
There's currently 3 patients at GV Health with COVID.
And how many have you had to transfer to Melbourne all up?
All up, the total transfers to Melbourne is 9 so far.
In terms of the testing you've seen over the last few days, are you feeling more confident about where the outbreak is at now, kind of as we get that 2-week mark?
It's good that there's no unknown transmissions in the community. I think that's a really positive thing in terms of today's numbers, and indeed that's been the case in the last few days as well. So all of the people testing positive in the last 4 or 5 days have been linked, and their acquisition source really clearly understood. It's I think from that point of view it's positive, but in relation to the fact that we're still seeing people test positive, that's not so good. And as I said before, we're focused on getting on top of that from an outbreak management point of view. But again, really encouraging people, if you haven't been vaccinated, ultimately that's the only way that's going to stop the spread of the virus in the community.
Sorry, on a slightly different note, the changes with the border bubble, does that affect you guys at all?
So we've had provisions for GV Health staff are considered essential workers and healthcare workers. The advice I've had today so far in relation to the border bubble and border closure changes is that our staff will still be able to move across the border. So some of our people might travel from Victoria into border communities along the river to provide services. They certainly don't go too far into New South Wales, but typically those border towns around, say, Cobram, Barooga might be a good example. And then certainly staff that may live in Mulwala or Barooga, they're able to travel as long as they're travelling down to the site where they're working and returning home. That's the purpose of their travel, that's fine. And we are just asking staff to make sure they carry their GV Health ID and or a letter from us to prove that they're an employee of GV Health.
In terms of patients that might be treated here, are they going to encounter any problems, do you understand?
No, that's so throughout the process in relation to the border changes, whether it be the New South Wales government or Victorian government enforced changes, there's never been an intent, as far as I understand, to prevent people from accessing healthcare. That's a legitimate reason for travel, and of course we wouldn't want to stop anybody from accessing healthcare that they may need. We've certainly made some changes to the way that we deliver services, so we might deliver more telehealth or video conferencing, using video conferencing mediums, FaceTime or other secure applications. But I would strongly encourage anybody living in a border community to not see the border closure or any of those related travel restrictions as a barrier to them accessing healthcare. That's not what any of us would want.